Good morning. Thank you, Christine. This is me. I'm Karen Hoare. I'm Associate Professor at Massey University, leading the postgrad programme for nurses, and nurse practitioner for children and young people at Greenstone Family Clinic in Manurewa, South Auckland. So my topic is the unsettled infant. So this continuing professional development resource is a fantastic resource. All medical students at the U of A and all postgrad nursing students are introduced to it. It was developed in 2004 post the epidemic, meningococcal C epidemic that happened in the UK, and every health professional that dealt with children in primary care were given a DVD. It's now been developed into an interactive website. It presents the 8 most common symptoms of children presenting to EDs and primary health care, and advise everybody to go onto it and have a look. It's free. I'll be using some of the resources that are in it during this talk. So the first thing is just from experience what happened. I've been working at Greenstone Family Clinic now for 14 years, and we've had 2 babies die because they were left in the waiting room, winter time. One baby was the child of 2 teenage parents, 17-year-olds, and the baby was in a pushchair all wrapped up in its blankets, and so nobody could see the baby until it was called in to see the clinician. So we developed this system of getting our receptionists to triage parents who came in with unsettled, sick infants. So they ask this question that relates to the NICE management of feverish illness in infants traffic light system, but in a much simpler, so easy to interpret way for people whose health literacy might not be that great. So the pictures correspond with the NICE traffic light system of how worried a parent is around their unsettled infant. So green, they want the baby checked. Orange, the baby's miserable and they're quite worried. And red, they're really, really worried because the baby's very hot and sick. So what is a fever? Parents get very concerned about fevers. Fever phobia was first described in the 1980s in a paper, and we still have it alive and well today. So a fever is a body temperature above 38 degrees. NICE guidelines suggest that these are the ways that fevers should be checked in infants and young children. But what's really important is that reported subjective fever does have good correlation with measured fever. So worried parents there is an evidence base that if a parent's really worried, then you need to take it seriously. So the 3-minute Toolkit of Examination really does only take 3 minutes to rule out whether your unsettled infant is actually sick or whether they are suffering from colic or some other fussiness, behavioural fussiness that's going on. It uses A, B, C, D, E, N, T. The D, E, F, G is don't ever forget glucose. I did a Pharmac day with Craig Jeffries, the Starship endocrinologist, and he was saying that 50% of children who develop type 1 diabetes end up in hospital in diabetic ketoacidosis, have been seen in primary care prior to the emergency event. I have to give a shout out. Some of this information comes from the Auckland Health Pathways, and in the unsettled Auckland community is local throughout the country, isn't it? And in the unsettled infant section, it states that you must look for an incarcerated inguinal hernia. Look for rashes, you want to definitely spot a non-blanching rash and think about urine when you're thinking about assessing for sickness in an infant. So where it says in the 3-minute toolkit, what is neurological, what is disability? It's neurological disability. So how alert is the infant? We have this aid memoir on every wall in every consulting room in our practice, because advanced paediatric life support suggests that any heart rate above those normal values is an orange sign for be concerned. So tachycardia above 160 in an infant is something to be concerned about. Teach parents the signs of serious illness. So again, following that meningococcal epidemic in the UK, parents were taught the glass test, which you can do just as easily by stretching the skin to show parents what's the difference between a blanching rash and a non-blanching rash. Also talk about nasal flaring, grunting, chest indrawing, increased work of breathing, and skin turgor when you're talking to parents about what to look for in serious illness. And if the infant falls into the green or the amber traffic light, make sure that there's safety netting advice so they know where to go if the child gets sicker. So if you've done the ruling out, the child's perfectly well, and the child's younger than 5 months, although one study suggests that really only 0.6% of infants have this phenomenon of colic past 3 months. This was actually, these two articles were in New Zealand Doctor back in 2012, 2013, written by paediatrician Simon Hoare and me. And actually, we used Dynamed for the evidence, and I just went to UpToDate to see if the evidence has changed around the treatment and management of colic, and it really hasn't. So the reflux, unpleasant but often benign, that's an article that's around, mainly around GORD, gastroesophageal reflux disease. If anybody wants these articles, there's my email, just email me, I can send you them, because they're sometimes quite difficult to find the back issues. So when you've ruled out that the baby's not sick, you need to observe what the relationship's like between the mother and the baby, and does the mother talk positively about the baby? Is there obvious joy in caring for the baby? Factors which affect parents in terms of their perception of crying and colic, because colic's described, there's no real definition, but it's described as crying for more than 3 hours for more than 3 days of the week. So there are different factors that will affect whether parents think the infant's crying excessively or not, and these are some of the factors that you need to think about when you're doing your history, good history. Okay. Purple crying. This is the mnemonic for crying and asking parents how they would describe the crying. And it's a website, the Kids Health website. You can send parents to this website. Think of the mom, especially in those early days, and the well-being of the mom. So if the mum's particularly anxious, and we do the PHQ and the GAD at the 6-week check, anxiety's absolutely normal in a new mum, and it's there for a biological reason to keep the child alive, keep the infant alive. But talk to the mum about apps to help with anxiety. the importance of exercise, the importance of looking after yourself, having some time out, and sleep, of course. And so they're just the resources that I've used. Again, shout out for the health pathways. There is a section on the unsettled infant, and the kids' health site's excellent for all manner of problems in childhood. Perfect timing.